Welcome to Navigate Newborn Screening, an educational program designed to help train and educate families about newborn screening. We are excited that you're interested in learning more about the newborn screening process and system. By the end of this video, you will understand the role of states in newborn screening, why screening is a state issue, day-to-day operational concerns for states, how to connect with those in your state. Let's start with the role of states in newborn screening. All states have a law mandating newborn screening. While newborn screening is required, most states offer options for parents to refuse screening. Newborn screening programs are organized, governed, and administered by state public health departments within each state's legislative process and regulatory framework. And the fee for newborn screening is often set in statute and is based on cost estimates from programs based on financial needs for testing and follow-up. The decision makers for newborn screening decisions are often state legislators, state health officers, state board of health, and advisory committees. Every state has a different structure, so it is important to contact your state if you have any additional questions. You may be wondering why newborn screening is a state issue. Well, this is mainly due to the history behind newborn screening. When newborn screening started in the 1960s, it was done at a state level, so each state newborn screening program has evolved differently since that time. Additionally, states have various priorities based on their population, funding, and resources. State and federal governments both make policy regarding newborn screening, so it is important to understand how they work together. While states are responsible for creating and managing newborn screening programs, the federal government supports states with additional funding, promoting the development of policies and guidelines, and helping with program improvement and quality assurance. While they receive support from the federal government, your state is responsible for managing the day-to-day operations of your newborn screening program. Most states are responsible for educating public, families, and healthcare professionals, getting specimens or blood spots to the lab for analysis, reporting abnormal or out-of-range results, short-term follow-up, quality control and assurance, storage and use of specimens or dried blood spots. So what does the newborn screening process look like at the state level? Every state process is different, but those are just a few of the steps and questions that state newborn screening programs consider when planning their newborn screening program. The first step after screening is transport. After newborn screening is complete, states need to ensure that blood samples are received from hospitals and birth centers in a timely manner and consistently throughout the state. They consider questions like, should they use a hospital courier system? How large is the state? Or do they pay for a delivery service? After transport is complete, the state laboratory will then test the blood spots. There are a variety of considerations within the testing process. State programs need to ensure that the reliability and accuracy of their screening test. They need to decide if babies born in their state will receive a second screen at 2 weeks after birth. They also need to consider second-tier testing, which means that the test is run on same blood samples as the primary screen. Decisions around testing may be different depending on the condition. After testing, the state newborn screening program must report results. Some questions that state newborn screening programs consider include: who does the reporting? Who receives the results, and how are they reported to the families? Will it be a healthcare professional or someone from the state program? What information is provided? All of these questions are very important, and precautions are taken to ensure confirmatory or diagnosis testing is completed if a baby receives abnormal results. This leads us to the follow-up process. During short-term follow-up, state ensures babies with abnormal or out-of-range screens receive needed follow-up testing. Long-term follow-up ensures that babies with confirmed diagnosis have access to the resources they need. When it comes to long-term follow-up, states may vary in their role and how they are involved. It is important to note that most states report results within 3 to 5 days of receiving your baby's blood sample if follow-up is needed. If you're interested in learning more about newborn screening or getting involved, there's so many ways to connect with those in your state. Number 1, connect with local groups, such as your local March of Dimes chapter, your State American Academy of Pediatrics chapter, your regional genetics network and/or support groups in your area. Number 2, you can also connect with your state newborn screening program manager or coordinator. To find your state's contact information, visit babiesfirsttest.org or your state's website. Number 3, finally, you can attend your state's advisory committee meeting. To do this, first check with your state. These meetings are open to the public. The meeting's location and time should be made available to the public. It's important to note that not all states have advisory committees. Remember that individuals and families can make a big difference in newborn screening.